MS Reddy sir, Director of Asha Bipolar Clinic and Asha Neuromodulation Clinics. And I invite Dr. Sridhar Raju sir, Proprietor and Director of Samarachana Kendram and Director of NGO name Samanvaya Samajika Vikasa Kendram. I welcome our distinguished speaker who has been forefront on to enhance mental health accessibility. Please join me in welcoming Dr. Pramod Kumar sir.
Is a topic, and then I think Dr. Pramod will be the good speaker because he has been practicing it for quite good many years. Telepsychiatry as an online consultation service. If you ask my personal opinion, I would definitely welcome it, and I would rather even say that it should be taken up in an accelerated position. Maybe about 10-15 years back, none of us would have been thinking about
next
it.
Slide and previous slide.
COVID has actually put the pressure on us. Mobile penetration and connectivity, these two things made it possible. I know there will be a lot of questions, what are the risks, what if you miss, what if they abuse. I'll use the last slide of Dr. Murali. Problems are inevitable, but so is growth. So there will be problems, risk, but I see the benefits much more. One of the most important thing being compliance. There seems to be a good improvement in the compliance when it comes to telepsychiatry, and definitely reaching the last mile that's one way we can do that. Now with these few positive remarks, I would request Dr. Sridhar Raju to introduce the speaker, and then Dr. Pramod can take care.
Good afternoon. Dr. Pramod, he did his MD Psychiatry from PGI Chandigarh in 1996. His current work is he is running a comprehensive psychiatric and neuromodulation clinic by name DPC, Dr. Pramod Clinic in Chandigarh. His special interest goes with drug addiction. He awarded with Dr. Bukshi Award of IPS, Best Poster Award, Indian Association of Biological Psychiatry. He had presented his pioneer work on ketamine in elderly in general hospital setups. It was presented at World Psychiatric Association thematic meeting, Melbourne on 26 February 2018. His original research paper on the use of Vertrextin in Indian population was presented at the annual conference of APA on 3rd May 2021, and second paper on May 24th of 2023. He is associated with IAPP, honored with International Distinguished Fellowship of APA. He is also Ambassador of American Psychiatric Association, Fellow of Indian Psychiatric Society. Please.
Thank you, sir, and very good afternoon to each one of you. And I'm especially thankful to Dr. MS Reddy, Dr. Ashok, Dr. Neha, who has found me worthy enough to speak on this very important topic, which is a topic especially for youngsters, but I would say even the senior psychiatrist cannot escape this as far as the current scenarios goes. If you look at this slide of my introduction, so anything unique? Anybody find anything unique on this slide? Yeah, so the uniqueness is it doesn't speak where I belong to. What is the name of my clinic, where I live? It's just a geolocation. My phone number and my website is my address. So in telepsychiatry, you are approachable, you are reachable to all the people who want to seek your services. This is the most important thing for you. So the first thing which comes up in digital psychiatry, telepsychiatry, they are all very much online practice, they are all synonymous words. If you look at the digitalization, what has happened over a period of time, the last 2 decades, the research has an evidence to say health sector is the last one to join. Everything has gone digitalized in the world. The last one to join is health. And India health has joined pretty late when it was left with no option. So that is a COVID. And today it's become the need of the society. Delivering mental health care through telepsychiatry is the need of the society, and for psychiatrist survival, also it is a need of the psychiatrist as well. Today you cannot have your practice, I think, by skipping this area. So before I go forward, let us see what is the unknown journey of teleconsultation. And is it legal to practice telepsychiatry? Because I have been doing telepsychiatry for more than 2 decades, I can tell you. So what has changed over a period of time is only the modality, the mode of practice. Every one of us keep attending to our patients' call every day and night, and we advise. It is all telepsychiatry. It is being come into the definition now, otherwise we are all doing that. And second thing is that, is it legal? This question was asked to me many years, since many years. What we are doing, is it legal or not legal? I think before 2020, before COVID, nobody was not even aware what we are doing is legal or illegal. And I used to say, what is not mentioned in the act, then it is not illegal. Whether it's legal or not, we don't know. But it is not illegal because it's not a part of the act as of now. So Telemedicine Society of India, I don't know how many of you have heard about this. In 2001, this society was formed, and their only idea was to have telemedicine in India. And from 2001, with so many state branches, nobody even knew. They have written to the Minister of Health and Family Welfare time and again for the next, you can say, 19 years, and nobody listened to them. The society, they did their national conferences also, but no law, no act, no rules have come for teleconsultation. Who can practice telemedicine in India? This was a question which was asked under RTI by one of the physicians to Medical Council of India, whether they can practice telemedicine in India or not. So you can say in terms of section 27 of MCI Act, any person whose name is enrolled in Indian medical registers can practice as a medical practitioner in any state of India according to his qualification, and hence interstate practice of telemedicine by medical practitioner is definitely permissible. And this question was asked by one of the doctor vis-a-vis, because in US, which is where most of the telemedicine happens, telepsychiatry happens, there you have a state regulation. If you are in the state of New York, you can't practice in San Francisco. So every state has, you have to have a state registration. Only in COVID, that even in US, they have removed this rule for the COVID, that you can practice telepsychiatry across all states in US as well. So this question was very pertinent, so that tomorrow nobody can ask this question. Then this question came up 2015, e-prescription. So the e-prescription did not come from the Medical Council, it came from the Pharmacy Council of India, and they have defined. So before going into the exact words, so it is simply a prescription which is written by a registered medical practitioner, and it should have all the components which a pharmacy can read, and they can it should not be reproducible. You should be able to produce the evidence that this prescription was generated, for example, at this Apollo clinic, at Apollo hospital on this date at this time, which is marked on every digital footprint. In 2016 came digital health records. So this came in all the digitalization, electronic health records, digital health records. This came by the government of India, the Ministry of Health and Family Welfare. They came out with the standards of the medical records, electronic healthcare records. So this was in 2016. There is a complete book on that. If anybody is interested, you can read that. And if you look down on point number 26, you can see e-prescription. So in 2016, the e-prescription was very much there. It was all clarified. And then this was followed by digital certificates. So all of us keep on writing certificates for our patients. So this was also written in the electronic health records of 2016. So all whatever you are doing, it is within the legal norms if you are doing all of this. Then in 2019, this came in Times of India. Modi government want to define e-prescription format to regulate online sales of medicine. Today you have plenty of the platforms and all the Indian, you can say the biggest, you can marketing leaders, whether it's a Amani or it's a Tata, they are all into this business. 1mg owned by Tata, and so they, because this is a huge revenue which comes up. So why it has come up? Because e-prescription have proved beneficial for patients' safety across the world. According to United States Health Department, e-prescription adopted in 2003 under the Medicare model have reduced the medication errors. You see, we are known in the society to write the poorest. Our prescription cannot be read, and there are plenty of places where prescriptions errors have happened and the patients have taken wrong medicines because the pharmacist couldn't understand. And you know how many, more than 90% of the pharmacy are not run by the qualified people. So they are run by unqualified people. So this was the whole basis, that's why it was adopted later by the European Council as well. Then came the most important thing in India. In 2020, during the COVID period, they have notified the Telemedicine Act, and then immediately 2 months later came Telepsychiatric Operational Guidelines. And I'm still wondering, and people do wonder, why this was a need to have this Telepsychiatric Guidelines as an independent thing which comes from IPS and the Ministry of Health and Family Welfare. But it did one thing good, that all the things which were in the black and white, or in the gray zone, they became into the black and white. So what you should do, what you should not do. That's very, very important. Then this question comes up. So, law for telemedicine in India. So what is the law, current law, which is governing the Telemedicine Council? So in the absence of a specific law, there is no specific law as of now in India for telemedicine. As the practice of telemedicine is fundamentally the combination of practice of medicine with information technology. So undoubtedly all the existing laws pertaining to both medicine and information technology in India would apply to telemedicine as well. So you have just given Information Technology Act and NMC guidelines. Whatever that they are and Telepsychiatry Operational Guide, till date only one case is registered in India under telemedicine guidelines. Do you have an idea on what case is that? Sushant Singh Rajput prescription written by a physician from Delhi, wherein alprazolam I think was prescribed to him without seeing him. That is the only case till date which is registered under telemedicine. During this time, the service from the government sector also came up for delivering the telemedicine, and e-Sanjeevani is one, you say, the service across all over India, and they are doing e-Sanjeevani wherein people get registered and then they can avail the services. But if you go into the data on that, the average number of psychiatrists are very limited, time spent is just a minute or two, and it is difficult to get across to all the information and all the proper services over there. And then, then came this previous year only on the World Mental Health Day, then this came Telemanas, which is again coming from the NIMHANS, and very soon you will see the integration of both the Telemanas with the e-Sanjeevani app. Now, when we deliver the telepsychiatry, that's the most important. This was all the background to just to understand what I am doing is right or wrong, is legal or illegal, and what are the norms. So this is important to understand, because if you look at the Western model of teaching in psychiatry, especially in psychiatry, in the first 3 months they will teach you what you are not supposed to do. They will not teach you what you are doing, because there is enough time to learn that. What you are not supposed to do, they will create boundaries around you. So that is the reason to adopt anything, this is important. Now first consultation, this is important, because how the people reach to you, how they will identify you. So what is the first source? Is your Google is the first source. Everybody go on Google for everything and anything. And they will identify you to become yourself popular. So that's altogether a different subject. So there are many people, they have become popular, they may not be even properly qualified or properly experienced. So the first consultation which reaches you, it's extremely important, because that is something wherein patient is not there with you face to face, and that consultation should be taken very seriously. So when you choose, when you have a patient, so always give them the option of online versus offline. Because even during COVID, there was a very limited period wherein the clinics were stopped. People were not going to the clinic. It's almost a 2 weeks period. But rest of the time, clinics were very much operational. I used to give patients the option which you want to come to clinic or whether you want to have an online consultation. If online, choose the platform as the patient choose, whether it's a WhatsApp, whether it's a FaceTime, Google Meet or Zoom. Choose as per the this thing, because this is what is called as an implied consent in telepsychiatry. It should instill trust and confidence, because when you speak to the patient, you tell them everything, it instills that trust and confidence. When people reach to you in whatever format, you must diagnose or at least understand the problem. Try to make an attempt on that. So everything which you discuss with the patient is not diagnosable. Because we have our training says that every patient who speaks, from our algorithm starts to work, and we start to find ICD-10 or which mood disorder, schizophrenia, and neurotic disorder, and we definitely try to fit that patient into diagnosis. I can tell you, that is how our teaching is. But everything is not diagnostic. There are plenty of problems which we face every day, and they are problems. They are not diagnoses as such. You should discuss the overall protocol of treatment with the patients, and it should never be forceful for anything. They may say, oh no, I don't think your diagnosis is right, I don't think you have understood my problem. Many times patients do say that. So don't be forceful. What you have understood, convey. What you have not understood, convey. And decide about what you need to do, whether you want to do counseling or medication or you want to refer the patient. Because in one of the consultation during COVID time, one of the very famous actress from Mumbai, she called me up and she was suicidal. She said, doctor, please prescribe me some medicine. I said, because your clinical condition doesn't allow me to write a prescription for you. In the best interest, please seek a local psychiatrist consultation. Be very forceful. Be very clear in your profession. Don't go beyond your boundaries, because tomorrow you may be in trouble. So you know that in first consultation, whenever the patient has, your prescription goes according to the type of consultation, whether it's a first or follow-up consultation, mode of consultation, text, audio, video, and the category of medication, you know the list O, A, B, and C, and prescribe medication with generic names only. And you know, you have read the telepsychiatry operational guidelines, and this is being copied from there. So what is list A drug? Are very limited number of drugs are there in list A. And list A, this is the first and new consultation. If you are prescribing a drug, it is mandatory to have a video consultation. One of the patients, she told me, sir, I cannot have a video consultation with you. I'm comfortable talking to you on a phone. But I say, I'm not comfortable to discuss your problem, to diagnose you, to understand you. She says, because I just got up, I've not even washed my face, I'm not in the proper state of, physical appearance. I says, no, you take your time, get well, because this is how first consultation has to be only video consultation. Even if whatever you are prescribing and deciding on the nature. Although, if you are doing only and only counseling, then even the video consultation, without video consultation also, you can go with the text consultation or audio consultation. But if you are prescribing, video is most important. But as a good practice, you should have a video consultation only in the first prescription. And these are the drugs like antidepressant, imipramine, asterotropin, fluoxetine, then mood stabilizer, lithium, carbamazepine, valproate. This is the list which is very much there in the telepsychiatry. And you must know that there are few things injectable cannot be prescribed. Schedule X drugs which are there, they cannot be prescribed in first consultation or otherwise as well. Then comes the follow-up consultation. In the follow-up consultation, the list becomes wide. A tele-follow-up consultation means delivering health telepsychiatry services to those patients whom you have seen physically in the last 6 months. Suppose today, if you look at it, any patient whom you have seen physically in July or let us say end of June, and today the patient calls you up for this, you can definitely give telepsychiatry consultation, prescription with list B, because list B is very wide. It has practically every kind of all drugs are there except the category which I have just mentioned to you. And the list C drug these are the psychotherapeutic drugs which are prohibited to be prescribed during telepsychiatric consultation, which include Schedule X and narcotic and NDPS Act drugs. The drugs which are very, very important from our perspective is benzodiazepine except clonazepam and zolpidem. Zolpidem is so frequently prescribed to our patients, but it is not included in the telepsychiatric guidelines in list A or B. So it is not to be prescribed. Although I know that we have discussed with Niman's team also that we have always questioned this in a written format also, that the list is, if there are proper qualified psychiatrists who are diagnosing, understanding, and when they can do physical prescription, all these drugs, so why can't it be done online as well? So this, I was told recently, because the Niman's himself, they think that the list is to be outgo, but the AIMS team, they do not want this drugs list to go out. So, but whatever is there. And if the patient you have not seen physically, only list A is applicable throughout. So you have to choose a drug only from the list A. So I used to say to my patients, if we want to broaden the drugs, so I think it's better that we make one physical consultation. And I can tell you almost every patient comes to your clinic, because that is how you can do the justice to the patients. Now next part comes the prescription part. So once you have done that, then comes the generation of prescription. So this is something which I have always been doing throughout my 23-year of practice, that I always believed in writing an electronic record, electronic prescription, electronic records keeping for all my patients, because this is in the best interest of delivering the good services from a medical legal point of view also. So how to write a prescription? I follow a particular model. Since my iPad could not be connected, I would have shown you there. So whatever I wanted, that it's difficult for me to write, type, dictate, because I have used all that. I use the dictation model, I say something, the computer writes something else. I've used this type model on like many platforms there. It's very, very time consuming, until you go to NHS model of seeing 2 patients per day. So you are in the rush and you can't have a repo and you are typing. So this model which I use, I write on my iPad with my pencil. It takes same time as my pen would write. It like instead of writing on a letterhead, I write on an iPad, that's it, and everything comes up on screen. I'll just show you. So you can use iPad or any tablet, Apple Pencil or writing stylus, and you have many softwares. I use practically GoodNotes 6 now and Notes and Bamboo. There are many platforms. Why GoodNotes I have chosen? This was the best software of the last year out of all millions of software which are there in the market. This takes the minimum space. On my phone, on my iPad, I have got a 4-year data of my patients always available to me. The longitudinal data. There are hundreds of pages of there. Always accessible to me, and it takes just 20 GB of data for the last 4 years. Very limited space. I do it on iCloud. And there are ways the people who come to clinic, and then you can write the same way. I write the same way, but I do it. I generate the prescription on a letterhead. Air printer is, because I use air printer is specific because why I use this term, because you do not need an internet, please understand that. It does not require an internet to connect, doesn't require, I would say Bluetooth connectivity, because this is an intranet program. If you're using iPhone kind of a devices, iPad, iPhone, and then you have a specific printers, they get compatible and you can generate the prescriptions anywhere. And in fact, you can have the option to generate remote prescription. I can write a prescription and it can get printed anywhere. That's also an option. So when you write a prescription, you should note down the standard things which you write in any prescriptions, but it should include all the components which you should write in face-to-face interview. But along with this, you should also write the type of, whether it's a telepsychiatric consultation, write teleconsultation. The mode you must write on the prescription, audio, video, text, and you must write down the time of the prescription, time at which the patient you are doing a prescription. So these 3 things are very, very mandatory for you to write. And when you deliver a prescription, you must have a stamp on it. And your letterhead should have all the components of your medical registrations. Then comes the digital prescription. It includes writing, printing, transmitting, and storing a prescription. Yeah, so this is the just some of the screenshots. So this screenshot, if you see on the top, there is a GoodNotes 5. Now we have a 6, and this is the kind of a screen which comes on an iPad. It gives you template, plain paper or a letterhead. You can just click a picture and upload it over here. And this is the cover page. On the cover page, you write the registration number. On the bottom side, you write an address. And this is the letterhead which comes up. On the letterhead, you write with your Apple Pencil everything, whatever is required. And once it is done, then it gives you the option to export, to print. If the patient is in clinic, you give an option print. If the patient is not in clinic, then you can export it as well. And it gives you the option to generate a PDF. And then from here, you have all the options to email. Because from iPad, you can't do a WhatsApp prescription, which is the most common channel. And then this prescription goes on, and then add to these pages. Whenever the subsequent pages comes up, it keep on giving you the option to add more page, more page, more pages, and you can copy. So sometimes what we do, don't have to write everything again, and you can just erase and you can write whatever the things you want to do. The same thing comes on your iPhone as well. And I'm not promoting Apple in any way. Please understand that, because I use it, that's why I'm giving you that template. So the same prescription comes on your phone, and the same, then you use it. Then here you come the option of a WhatsApp, and then you can WhatsApp this. Now this is an iPad, iPhone, MacBook Sync. Everything is coming on everything. And that is how the beautiful part is. One of my patients just in USA, the person has traveled to USA, she has gotten a cardiac issue, the lady, and she went to an ER care over there, and the son called me up, and they were not knowing what prescription. So I could immediately send all the PDF, because the doctor over there wanted all the prescription. It just took me just a few seconds, and I could send all the file over there with the consent. Like I was saying that I have been practicing myself for more than 2 decades, but this is an area which requires an absolute training. It's very simple. It's not complicated at all. It's very, very simple, but it requires a training for that. I met my friend Dr. Vishal, I think. Yes. So we met in Hyderabad. I conducted a workshop, and he attended my workshop. And from that day, he says he has been practicing iPad prescription, and it's happy. He's very, very happy. And says even that has generated a lot of revenue for me, and I can charge more because patient sees that a clean table and only with iPad. So मैंने इनको बोला जो दिखता है वही दिखता है. That's it. I have delivered plenty of talks on this, conducted very workshop, and since last 3 years, I have been doing, along with my team, workshops at all the NCIPs. This is the article which was done across multicentric study from PJ mainly. They tried to understood what is the telepsychiatry, and you look at the survey monkey they did in June to July 2020. Only 6.83% of the people they have responded back to the survey. And 76% use smartphone audio consultation. And look at the platform, Zoom platform was used by 1/3 of the population, because Zoom nobody heard before COVID. This company has come up suddenly, and now everything is Zoom, Zoom, Zoom. And then there were other platforms like WhatsApp, Practo, and HealthClicks and Library. 3/4 provide prescription with their registration number or letterhead, which is mandatory according to me. 2/3 felt in-person consultation is better. 42% preferred combination of audio, video, and text. 84% use telepsychiatry in Asia as compared to 20 to 30% in US. Because in US, the telepsychiatry is greatly regulated. There is a software, which is only one software they have, which is to be practiced. And they have a strict guidelines for that, because it requires much more responsibility. Now this is another very, very important questions which keep coming to us, and people do ask me, what about the international patients whom you see? And many of us, like Hyderabad is known to have plenty of people who are abroad, and you see them, they come here, take treatment, or they visit and they go back. What is to be done about them in telepsychiatry? Please understand, I'll tell you the major countries. USA. Now rules for traveling with medicine into US. The prescription should be in English. The prescription should clearly explain the medical condition and the cause of taking these medicines. You can only get medicine for your own personal use. During your stay in US, carry no more than 90 days supply of medication. You can definitely write a prescription. The person can definitely procure the medicine, and with your prescription can carry 3 months stocks of medicine in US. There is no confusion on that. And 90 days is the rule. All countries have this 90 days rule. Except, exceptionally, until you write something, then you explain why the longer treatment is required. This is the first time in my 20 years of career, I require only one clarification. The minister from US came to me. They written an email to me, and then for one of the patients who carrying 6 months stock of OCD medicines with him. He's a resident over there. He's a medical resident and my patient. So I written this. This prescription is meant for sending medication overseas to Mr. Amma. The medicine went in courier. Who was under my treatment since long. He's having OCD, which is chronic medical condition. This medication cannot be changed or stopped abruptly. These were the line, and his medicine goes to the patient. Okay, so this is something which you write and you must be aware of. So many people ask me, can they take, they cannot take. Australia and New Zealand, travelers can bring a 3 month stock of medicine with valid prescription for self or immediate family member traveling with him or her. Many people, small children or elder people, but you cannot carry medicine for others. That's a very, very important to understand. You cannot write a prescription and the person is carrying. Traveler not allowed to bring in following medicine: benzodiazepines, morphine, methadone, oxycodone, methylphenidate, Adderall. Now I'll tell you, just a few days back, one of my patients, he plays cricket for, he's an international cricket player in another country, and he's a patient with ADHD. So he's being prescribed Concerta. So he comes to India, take a prescription, because in that country the psychiatrist refused to write Concerta for him, and because it comes under WADA as well, because then they get a check. So he came to India, we did an assessment, written a prescription for Concerta, and he could carry it back. Because your prescription, your diagnosis, and that should match and should be authenticated. So few medicines, like recently Australia and New Zealand have become very, very strict with clonazepam, which we are writing frequently. If you run out of medicines, now this is another question which comes up. If you run out of medicines, your patients are there, what is to be done? Consult local GP or psychiatrist for refill of a new prescription. I can tell you till date, writing hundreds of prescriptions, no psychiatrist, no GP ever have refused a prescription given by me or given by anybody. But they can go to a GP or they can go to a psychiatrist and they will refill your prescription. Can import 3 months stock of medicine with valid consultation. So you have a valid consultation with them, write down everything, you write a prescription, follow up prescription, give it to the patient or the family members. But again I'm telling you, if you're giving to somebody, take consent. I always tell them to write an email to me or write on my phone that please hand over this prescription to this. It's a consent. Then they take the medicine and they can send it. The medicine should not fall under restricted category. That is important. Like I have told you, Australia and New Zealand, what are the restricted category? In Canada, visitors staying in Canada for more than 3 months can bring into Canada an additional 90-day supply of health product every 3 months for their own personal use by mail or courier. They are very clear. Canada, it's written on their Ministry of Health and the External Affairs. It's a kind of a website they have. They have written they can carry more than 3 months stock of medicine and they can get it couriered as well. Visitor to Canada must be ready to provide evidence of their visitor status. Evidence include their copy of passport, student or work visa, letter from an employer or a university. As a visitor, if the drug is emailed to you, you are encouraged to include a copy of any of the above documents in the package and indicate on the outside of the shipping package that it is destined to a visitor in Canada. Your prescription, bill, and the person's own passport. If the 3 things go, that can very easily be carried into Canada. 90 days of supply can very easily be carried. I'll still give you one caution. That's my personal advice. To avoid liability, however, it is not advisable to practice telepsychiatry if one does not have the appropriate technology to ensure reasonable security, confidentiality and privacy, it is not mandatory in India to practice telepsychiatry. It is your own choice. But if you are not sure what you are doing, many people have seen they talk of sometime here and there, sometimes people are in the car, they are in the washroom and they are doing telepsychiatry. I would say please do not do that. Always do telepsychiatry in your consultation chamber only at the right time. I came to Hyderabad yesterday, one of my patients messaged me at 9 p.m. that, sir, can I have a consultation? I missed my appointment. I said, no, because I gave you time, take another appointment. Because it's very inconvenient for me to sit in a hotel room and do a consultation. That's not advisable. So do it, make a slot in your clinic and do only during that time. Because on the go sometime you are not serious, something else is going on and you may make some kind of an error of judgment. So don't do that, it's not healthy. So that's, I'm before time and I think I have not made you hungry for a little longer. Thank you very much.
Covered quite reasonably, and then put a caution also in the end saying that up to a point, and then beyond that if you are not comfortable, don't do, and certain limitations very clearly. I'm sure we have another 10 minutes and then there can be a lot of questions. Yeah, I think.
Sir, totally enjoyed your talk. Thank you for that, sir. This is Raviteja from Nizamabad, sir. Sir, essentially when we talk about telepsychiatric services being offered to our patients, we are already coming to this that we are not able to address severe mental illnesses, and largely common mental illnesses, and not to offend anyone, but largely they may be little higher neuroticism. So they would want to consult you over and over and over again, and once they know that you are very accessible over the phone, they tend to repeatedly take appointments or repeatedly make calls, and that can add to a lot of stress and burden. Sir, I wanted your wisdom and opinion as to how to handle this, especially for younger generations wherein more patients are demanding telepsychiatric services, and being accessible 24/7 is a mandate for emerging private psychiatrists. Thank you, sir.
Okay, very important question. I would suggest, see, ultimately we are the service provider. We are made to deliver services. If the more and more people are asking for services, you should be ready to do it. But do it within the timeline. First of all, you are not 24/7 available. It's not an emergency service for the patients. Number two, like I practice, I do not do telepsychiatry without proper appointment, number one. Nobody can just write a question to me, and even if they write a question, I charge for every question they ask me. It's very much mentioned on my website. For every question, they have to pay 300 rupees in advance. And it's not new. My website was in 2006. Still I am charging. I can tell you, this is the way you deliver best with less of the discomforts. Third, it is not at all free of cost. If patient want to have consultation every day, do it. But do it within the time frame. Don't make yourself available free of cost at all point of time. So this is how you set the norms of teleconsultation, and the people will follow you. I can tell you, your strictness will be followed by your patients. Otherwise, I can tell you, if you are not available, they will approach some other psychiatrist at the same time. Don't be insecure. You have created your own worth, and that worth should be read by the society.
I'll also add a point to that. I've been practicing telepsychiatry. It's always in the consultation appointments, pre-appointments. Without that, somebody cannot call you and then ask for an appointment. And this kind of, just because you are available, it's paid consultation. I don't think I have come across anybody who is repeatedly asking for. They do message sometimes saying that we have this problem and all that. That comes to a middle person. Secretary is there. She'll take up the messages and then we do that. This problem. But as you said, serious mental disorders like psychosis, most of the time, unless it's an old patient, you do not take up in the first place. That's it.
So, two questions.
Now during lunchtime, look at my website, how to book. On a Google, just write Dr. Pramod clinic appointment. Just a simple thing. My window will open like Book My Show. They will tell you my available slots. They will tell you my consultation is 2,000. My online consultation is 3,000. If it is family consultation, means 1-to-1, if there are 4 members who want to, it's a 4,000. It's mentioned. I can tell you why. The reason is very clear. People like to say, sir, phone पे बात करने में तो कम पैसे होने चाहिए, because I do not encourage this model. I'm strongly against this model. This is a service for the specific use. So I charge and they know about it. So once you pay them, you pay, you come up and my website itself confirms the appointment. If within 15 minutes of making an appointment, the person does not pay, it sends a reminder for another 15 minutes. If still in 30 minutes it is not being paid, cancel. Why should I keep my half an hour available when I am not being paid adequately? So this is how my website, you can try to book an appointment.
Yeah, I have two questions. One is, what are the guidelines for UAE? Because many times they just throw away the medication even in the customs. That's one thing. And second thing is about, did you ever face any patients, overdosage? And then at that time, what is the best way to interact? Because guidelines will be there and all that. I don't think it's there in guidelines also.
No, sir, as far as UAE is concerned, definitely in UAE, there are the restricted drugs, the list of restricted drugs, Schedule X and NDPS Act is, the medication is not advised over there. The same rule is applying in UAE as well. Rest of the medication they can definitely carry with them on your prescription. There is no separate law in UAE. UAE follow the American model for everything, whether it's a medical education or a medical health delivery. As far as the second question is, the patient has, you have prescribed, the patient has over medicated himself and they are got into intoxication, it's none of your problem. You refer them, go to emergency services, because it is otherwise it's not something for which you can do anything. There are plenty of situations. You have to just tell them, consult a ER services, consult a local psychiatrist or a physician. They will take care of the rest of the things.
The US is very liberal. But UAE, one of the problems I faced is that whenever there is a benzodiazepine, they block the prescription. So they ask for a separate prescription. Sometimes they can't carry the entire lot. They ask for separate. But in overdosage, I think we have to treat teleconsultation as like any other regular consultation, which can happen otherwise also. And at this point, I'll tell you, at any point of time teleconsultation, you are not comfortable that you are not getting the proper information or something is missing. You have every right to say that the next or tomorrow you please come to my consultation chamber, I will not be giving the prescription. That all the time you can do that at any point of time. And consultation can be refunded also. That consultation. That's always we do that.
I tell you, last week one of my patients, like she's under my care from Canada and she's a cop. So she called me on Saturday and it was a scheduled appointment, Friday evening for her and for us Saturday. So it was a scheduled appointment and she called me from one of the club and she was totally, and she talked to me and says, I found her that she is in a state of intoxication and dress was not appropriate for this session. I told her, say miss, I think this is not the right time to have consultation. This is the best time to enjoy your life. So better enjoy your life now and we'll talk about it tomorrow. This is the best way to avoid consultation. And secondly, I've advised one of my friend in one of the conference, I've seen him in Kolkata conference and he has got in 4 packs of whiskey and he was talking to a patient at that point of time, video consultation in one of the conference banquet dinner, I can tell you. I says, please don't do these kind of things because it can risk your professional career.
Thank you, sir. I'm Dr. Anita from Hyderabad, sir. Your session was very informative. Sir, one question is, like if we follow up the patients online who are abroad, who are previously your patients, they moved to abroad. So what are the legal implications and problems we might get, sir?
Okay. As far as the legal problem, you see, if you read this telepsychiatry operational guidelines, in the end they have written the jurisdiction of telepsychiatry guidelines is in India. You have read that line? It's mentioned. So whatever is written, whatever is being done in the society, there is a jurisdiction word. Let us say, if Dr. Reddy is practicing in Hyderabad, his jurisdiction is, let us say, Telangana state. So that jurisdiction is India. As far as the law is concerned, if anything happens, the person is in abroad and they want to complain against you for anything, for example, they have to approach Indian court. You cannot be held responsible in that country from the person where the person is originating. So the law is applicable to India and if you are following, nothing to worry as such. because it is somewhere telepsychiatry guidelines is opposite to the medical tourism guidelines. Medical tourism allows you to do everything, write a prescription, dispense a prescription, courier a prescription to any country. So the law of India will be applicable in telepsychiatry.
Sir, good afternoon. I am Dr. Munawar Hussain. I am from Gulbarga, Karnataka. Indemnity. How do you see the future of telepsychiatry 5 to 10 years down the line? And one input I'd like to give about the UAE situation, sir. If you want to send a prescription along with your patient and the medication, you have to tell the patient to apply it to the health authorities in UAE, sir. If they approve of it, it can be sent. Otherwise, most of the controlled drugs are not sent, sir. Thank you, sir.
So I always write on my prescription that the person, whatever the patient's name is, and I always prefer them to write as per the passport name, is under my care, he is traveling to this country, and please allow him to prescribe the medicine for this much duration of time. Now coming to your question, what is the is very much covered, because a lot of my patients, they take prescription from me and they take the charges from the insurance company or their offices. So that is why they always ask me to generate a bill on that particular day on which the prescription has happened. You know, sometimes they transfer the money later, but your prescription is another date. So professional indemnity, if it cover your OPD prescription, that is very much legal in India. That's very much allowed. How do we see 5 to 10 years from now on? I think it's a very promising area, and telepsychiatry is something, everything is moving in a digital way, and gradually the way the number of psychiatrists are increasing in the country, and I think by you see the kind of a practice which is going to be there, I think telepsychiatry will have a upper edge as compared to the physical practice.
Thank you very much, sir. And we are,
so just one short question, sir. What do you do if someone tries to record the conversation?
Let them record. There is no problem. There is nowhere it is written you cannot record, because if you are right, you know, that is why reason I always, because that's a different presentation, etiquettes. Telepsychiatry consultation etiquettes. Many of time I have seen people talking casually, not appropriately dressed, not in a proper location. If the person wants to record your conversation, they are very much happy. You are very much happy to record it. I always, if they ask me, I never say no, because it's their right to choose. But if they don't ask, many people are recording without your knowledge as well. So let them record.
It never happened to me in telepsychiatry, but last 40 years, once in the clinic it happened. Patient's brother recorded it and filed an FIR for putting the patient in the rehab center or something. It happened in the clinic. I didn't even know till the policeman came to my room saying that whatever you have talked has been recorded. But most important thing is, whether it is a tele or in the consultation room, don't be very casual. That is more important. Be it as professional as possible. Otherwise, there is always a chance of using loose terms.
Sir,
thank you very much. Thank you.
I just have one question, sir. Is there a response time, because patients approach you on WhatsApp or email, and since we are available and now you can see the status online now, so do you have a response time that you are supposed to respond within so much time, or there's no legality related to it? You can read a message and choose not to respond.
See, there is no legality, number one, but there are some best practice standards, I would say. You can definitely choose not to be shown online. You know that on WhatsApp.
Yes,
it's
yes,
very easy for
sir.
you. And you can choose whether you want a blue tick or you don't want a blue tick. That's easy. But if you look at your geo-mapping, if you look at my geo-mapping on Google, for example, if my response time is 30 minutes, okay, have your notification on, tell them in advance what time to what times you practice. Like I have a slot of 4 slots per day for telepsychiatry. So if you are responding within the time frame, it's always better, because that will make you popular on a Google SEO engine. So your rating will go up, because I was in one of the conference on health, digital health, by one of the international platform. Now, today everything is hashtagged. You know that everything is hashtagged. Today I write Dr. Pramod, best psychiatrist, Chandigarh, India, Google. So my ranking will change. And so I do this kind of programs as well. So how to make myself visible more, rather than taking the packages run by Just Dial and others. They will say, oh, we will rank you number one, we will keep you for this particular time. Now the next era is coming content based. Hashtag is going to be out, because hashtag is now, the season is over now. Next is going to be content based. So whatever you are doing online, writing a blog, people writing about you, sharing your knowledge. Let us say if you write this presentation. So next is going to be the pure scientific way. The people will get ranked upper and down. So there is no legality, but as a good practitioner, it's better to respond. Maybe you respond like this. Okay, I shall be contacting you, or you can take a fresh appointment. You can contact me tomorrow, rather than having an automated message. It is not a desirable. Oh, Dr. Pramod Kumar is not available in his office like US people say, so he'll contact you on the next working day, that is Monday after 36 hours. That's not something which people appreciate that. You write your own message, but definitely not all the time.
Thank you, sir.
Okay. Thank you, sir, for the expert perspectives that you've shared. I request the chairpersons to present a memento to the speaker. I request the speaker to present a memento to Chairperson Dr. M.S. Reddy, sir. I request the speaker to present a memento to Chairperson Dr. Sridhar Raju, sir. A thank you to the speaker and the chairpersons. Let us now take a pause for academic feast and proceed to a Hyderabadi feast. Apologies for the delay. After lunch, we will gather back here at 2:45 for the next session. Thank you.